so that nobody misses it. Okay, here we go. Okay. Warm welcome, Amit. You know, about Amit, I can speak on and on because very early when I started in this field, he was one of the person who used to encourage me a lot. I mean, as a parent professional, rather I was that time not working professionally. That time I was just a parent, but I wanted to do something. I think I was the first person whom I approached to get knowledge or start know-how. It was Amit. And he always encouraged me. In fact, his heart is here, his body is somewhere else. His family, his work. So he started from here. It doesn't mean that by going outside India means he has forgotten his roots. He's one of the most rooted person I've ever seen. And there's a tremendous respect for him is in my heart. And I call him my little bro also. Now, bringing him on this platform for interaction session, there is a huge reason. You know, the kind of respect we have mutually is because we exactly know what we teach our parents, our students. We absolutely, we stick to evidence-based rules. He is one of those occupational therapists which have, who actually teaches the right thing, which is somewhere absent in Indian context. So he is doing lot of awareness. He has live sessions too. And I'm so thankful that Amit has come over here. Now, before I introduce him, there are two rules I want to tell everyone. Please open up your video. Otherwise, it looks very odd and rude. Mute yourself. Okay, first thing. Second thing, whoever wants to ask a question, like Meghna has already sent the name, everybody will put their name in chat box. I don't want anybody to raise hand. Everybody should get a chance. Let's do that serially. Okay. So if Meghna is speaking, the very next one, you know that it's your chance. Be ready. Let's not waste time. Okay. And now time for Amit. Amit, please introduce yourself.
Yeah, Nilanjana, thank you so much. Like, you are inviting me here, and yeah, it's a great honor always to talk to you and talk about especially the professional things. I mean, yeah, Nilanjana already told about me, like I'm an occupational therapist. Yes, and that's my identity. And I would love to hear, like, you call me just Amit. I like this. I like my name, so just call my name. I do not need any prefix to add on it. Yeah, that will be good for our discussion also. And feel free, because don't feel like I'm an occupational therapist or I am a professional, so that's the reason I'm here. It's not only that. I'm here also, I feel like our society needs a lot of things, so I try, like, as much as much I can contribute. And so you are everywhere warrior, you people are doing like awesome job. So I'm just with you. I mean, to try how much I can support you. That's all. Like, and I'm not going to do any miracle, but you have the abilities already, what you need to do. You know everything. It's only some frame of reference, maybe I know, I'm just putting there that one, that's a different context. But end of the day, it is like something we need to work together. And why I like Nilanjana, one of the reason is, Nilanjana have understanding how really, the rehabilitation and this all learning process works, how human brain works. It is not like jumping everywhere. Human breaks, human brain needs organized thing. It cannot be like jumping here and there and, like, going towards something that it's not visible. we need goal. So I found like Nilanjana is very good about it, and she has a strong vision, like she knows like what she's doing, and that really makes me feel okay, I can actually come with my knowledge, what I gain, like what we call in our professional, we always say like, oh, what frame of reference you are using, so you have a branch, like okay, you need to go to this way or this way, and what next, that only the way I can help her. But when I see now these days, like how she's talking, actually, it's like I really didn't get time, but sometimes I really watch, like, I'm just walking and watching her video and say, wow, she's so good. And, so that's the thing. I think it's nothing I'm going to share here, like nothing new for you, but maybe I will help you to just organize your thought a little bit, like what you know already. It is something like not really new I'm going to tell you, but maybe something like how you just organized your own thought, what you have already. Yeah, let's see how I can help. Yeah,
absolutely. Thank you so much. So Amit, really honored. Thank you. So let's go on with the very two things I want to start. The very first thing, how much assessment is necessary? Because what I find most of the parents, today's session will be in Bengali, Hindi, English. So no worries if somebody says,
হিন্দি আমি কিন্তু
oh,
হিন্দি
I am
বলতে
there
পারি।
to put in.
ঠিক আছে,
I
তুমি
am there.
বলে
I'm
দিও।
there. I'm there.
হিন্দি বলতে গেলে আমার একদম মানে যাতা অবস্থা হয়ে যায়।
I am there. I'll help you. No issues. So the very first thing, most of the parents, they come up to me. A lot of them actually in a very early stage only, they are aware that they have to go to occupational therapy. Why they have to go, they don't have any knowledge. But it's okay. The doctor says speech and occupational therapy korte hobe. So they go. Fine. But what I find that the program given to them is without any assessment. How much this assessment plays a role, number one. Second thing, how much it is related to IEP and goal setting. Can you, Amit, say that? This is something parents should know.
মানে এটা দেখো, এটা হচ্ছে এটার প্রবলেম, এই প্রবলেমটা না আমাদের ফাউন্ডেশনাল প্রবলেম। আমি জানি না অন্য স্টেটে কিরকম, কিন্তু ইন লাইক তোমার বেঙ্গলে যেটা, এটা ফাউন্ডেশনাল প্রবলেম। the thing is like, first of all, you need to know, like, what is the problem, in your child. It is just a you can't say like, oh, he can't do it or he doesn't want to do. No, you can't say it. Even if you go to the neurotypical child also, they also don't do a lot of things end of the day. So প্রবলেমটা হচ্ছে কোথায়, যখন আইডেন্টিফিকেশনটা হচ্ছে, কখনো দেখা যাচ্ছে একটা বাচ্চা 2 বছরে হচ্ছে, কখনো একটা বাচ্চা 4 বছরে হচ্ছে, আর কোনো বাচ্চা দেখা যায় 8-9 বছরের আগেও হচ্ছে না।
Absolutely.
Sir, either Hindi or English, please. I cannot understand Bengali at all.
Okay.
Let's speak to English.
I think English will be good. Okay. The thing is the main problem is there. Like, see, first of all, still the medical, like who actually responsible to do the diagnosis, there is a big, the error. Basically what happened when some problem you see in your child, you bring your child to pediatrician or neurologist or someone, and there is the main problem, because they really, I feel still in India, they really don't know where to heads on next. They just try, okay, you do this one, you do this one, you go to the occupational therapist or just go to the speech therapist. But the thing is, based on the analysis and the diagnosis, you should actually take the decision on the early stage. That's the reason this is called early intervention. Early intervention is not just a word. It's actually, it's a lot of things, because the way you do analysis at early intervention, and for a child, like 8 years old, the way you will do the analysis for 8 years child old, it's totally different. So what happened, I know there is a problem because the referral systems is not working nicely, but still parents will struggle, they will see videos from here and there, and end of the day they will understand they need to go somewhere, and they do it, without even doctor advice. They do it, and that's the way. Actually, it is the main now these days. I think the main resources is actually social media, and like some other platform like Facebook group or WhatsApp group. That is the only resources for parents. Still, I can see pediatrician, they don't really direct like where to go. Okay,
Exactly.
so this is one of the barrier actually. So what happened? The analysis, when we will say, the assessment, really, when you say assessment, it's depend on what is the age of the child. So basically, like if a child is 2 years old, the analysis will be what? A 2-year child's occupation is what? It is only play. You can't get anything apart from play from the child who is like 2 years old. But a child is 8 years old, his occupation is much more than the play. It's not only the play. His occupation may be academic, occupation may be daily living skill, like ADL যেটা আমরা বলছি, daily living skill and occupation is include. Now what happened if you don't do this assessment? What we say functional, right? Functional means it's nothing, it's performing your occupation. And occupation means what? Occupation means whatever you are doing for your living, that is called occupation. Whatever you are doing for your living, if you just hold a glass and just drinking from it, it's occupation. So what happened? You can't expect this from, this occupation from a 2-year child, but you need to get it from a maybe 4 years or 5-year child. And why we need it? Because this skill determine what is the level of the child really doing the things, what is age appropriate or not. Like how you say like, oh, your child is 5 years old, is still not toilet trained. What does it really mean? Because we expect the brain is mature enough at the age of 5, so he can do the toilet by himself. So biologically, the brain is ready. So it is all come through the assessment that what the child can do, what the child can't do, and it is really matching the age or not. So that will help you. Where is the problem? So first, obviously, the diagnosis is important. But after diagnosis, if anything, measure things, that's the assessment, especially the functional assessment, because that will help you, your child really growing or not. And if not growing, how you can help. Now here the thing is, when we see the human dynamics, human dynamics. So a child, he may, he can do everything, like oh, he is okay, he actually can do everything. He can brush by himself, he can wear dress by himself, he can do everything, there is no problem. But this is one of the aspect.
Yes.
When we see the dynamics of a human being, the ADL, activity in daily life, it's include like some basic things like toileting, feeding, dressing. But apart from it also, you have a lot of other things. And why we say sometimes, when the kid was 3 years old, he didn't have any issues, he was absolutely fine, but he is growing up and the issues is more. No, actually, when he was 3 years old, the issues was there. Yes. The thing is, the demand of task was less.
Yes.
Because you didn't expect from a 3-year child, they will do like communication to the others that much, because they are in the zone of like, parallel play or maybe isolated play. But
that's
when
the bottom line, Mami. That's the bottom line.
That's the bottom line. But when he's 6 years old or 7 years old, obviously you will accept he must go and play with others. So what happened? The demand of task increased. And that's the reason you feel the problem is more, but the problem was actually at the like stage 1, like when he was 2 years or 3 years. So what happened when you really do a proper assessment, it helps you to understand, even though those problems are not visible, but there is a problem, and that's the professional job. That Nilanjana, those are experienced with it, they can help, like occupational therapists, they can help. Okay, that's the reason the assessment is necessary. Without assessment, somebody, oh, this is a problem, we'll fix it. No, you can't fix anything. You
So
can't
very important.
fix.
Yeah. And a goal setting is also important.
Yeah, I come one by one. So this is one. The
Yeah.
second thing now, so only the OT is everything, or only the ST is everything? Okay, end of the day, we need to know, when we develop professional, like, psychologists, we have occupational therapists, we have physiotherapists, it means everyone have a different role. Everyone have a different, OT has a specific role, speech therapist has a specific role, special educator have a specific roles. It's mean, yes, maybe some child, they don't have all issues. There is lot of child referred to me, and when I see them, I found their problem is only the perception, the thought, and it's more psychological, but they feel it's actually maybe some sensory issues or something. I actually directly say, oh, it's good you came to me, but I can't help anymore, because this is I'm not the expert for it. Yes, I know little bit, I need to know little bit, because so I can actually refer the client who can help him or her. So with the assessment, again come to with the assessment only you can do it better way, because you are confused, you don't know the problem is actually emotional regulation or the sensory regulation. Where is the problem? You don't know. And you need to choose the right professional. See, OT doesn't mean they can do everything. No, we can't do everything. If OT say like, oh, I will fix your child or something, I can do everything, then he's absolutely wrong. No, every professional have a limited responsibilities, and you need to know this. I know, like some OTist, even some speech therapist, I see like they're doing everything. No, you can't.
Absolutely.
You can't. So you need to know when the speech problem is there, where to go. When some motor function problem, is it really related to like sensory motor or something, or it is related to typical something, what can be addressed by a physiotherapist. So you need to know this, then you can actually go to a right profession, and definitely with the expertise of the professional, you can get the benefit. So that's the reason it's very important to choose the right profession.
Absolutely.
And now third things, third things, your goal making.
Yes.
So what happened, what I say, like without goal, if you can't, like when you do the goal, we call it a smart format. Smart format means something should be visible and something should be measurable. I cannot say, oh, my child brain improved. No, can't say. We only can say it when we measure it. How we measure it? As an example, when the child first time came to me, maybe he was like, he was scared about some situation. The situation, maybe it can be very simple thing, like he doesn't like mashed potato. So when he sees the mashed potato, he's like, he like, showing tantrum or something. Even he can't tolerate it by looking it. So the goal can be like this, the child will be able to toss the mashed potato, and after how long? Like in next 6 months or 1 year. So what happened, even though it's a very specific goal you are making, but when you are making this specific goal, you are working in holistic way. You are helping the child in holistic way to achieve the specific goal. That is really called the brain development. And you can measure it, like, because after 6 months, you really can see it. Where is my son now? That you need to do. So without goal, if you do something, you are like you are playing a football game, and you are going with the ball here and there, but you don't know where really, you need to kick the ball and get the score. So goal making is very important. And IEP concept is basically for the education purpose, especially those are in the school, like a special school. So what happened, because every individual have different potential, every kids have different potential. That's the reason you need to plan individual educational plan.
Yes.
And when you do the individual education, it means there is a classroom. In a classroom, there may be 5 different students and they have 5 different, the functional skill, the level may not same. So what happened, even you choose the same goal in the same area, suppose it's a goal is art and craft, some goal, like every child will be able to painting about, some like something will be, painting, but you can do the gradation, like how much the student A will do, how much student B will do, how much student C will do. So without IEP and without making a proper goal, if you do something, that will be absolutely right. You are just doing something blindly. It will not help you. Yeah.
Absolutely. Okay, thank you so much, Amit. Meghna, you can ask your question.
Hello, sir. Sir, I've already mentioned it in the
Call me
platform. Okay. Right. So my child, he's 12 years right now, my son, basically, and the diagnosis is the tuberous sclerosis complex. He used to have seizures, started getting seizures when he was 2.5 years of age. And in the MRI, there were certain tumors at various areas. Consequently, he used to have seizures, which now are quite a lot controlled, but rarely there are episodes of seizures. And my functional limitation is he's unable to spit. I've tried many things as per my best ability, but as of now he's not able to spit and he's 12. So that is my main concern.
Yeah. So you can see, first of all, you really ask this question to I'm not the right professional to answer for it. This is a problem. Because what happened, you feel like occupational therapists, they can do everything. This is a problem. So you should ask this question to a speech pathologist. Yes. So they can really help you, because this is some function really need to, addressed by a speech pathologist. Speech therapy doesn't mean they will only work on the speech. No. They will work on the oromotor system and oromotor functions, like how to speak. That also it actually come from them. Okay, but here still I can help you in a little bit. As I said, I'm not expert, but I can help you a little bit as much knowledge I have. The thing is, first of my question is, does it really affect, how it is affecting his life? The first question. Because he can't do spitting, how it is affecting his life?
See, I am a dentist, so I understand the value of spitting the toothpaste. It is quite sort of toxic, and it should not be ingested at any cost. It should be spitted always. And whenever we brush, he brushes his teeth, he's always taking all the paste inside. I cannot see you.
You can't see me. I don't know. I didn't do anything.
Yeah, now I can.
Okay. Okay, I will help you. I will help you. I need some, basic understanding.
His quality of life in any way, but yes, a toothpaste should not be ingested. They are toxic actually.
Yeah.
That is my
So right now what he is doing, he is actually swallowing it, is it?
Yes, he is. Though
Okay.
I've been doing various herbal toothpaste which have minimum chemicals in them, but still my concern is that we should learn to spit, so that paste should not be going in.
Okay. So the second question, so far, how did you train him?
As for spitting, I've been trying various things which are very bitter in taste, like neem
No,
oil.
I need to know how you really trained him, because he is 12 years old. I believe you have been already trying a lot of approaches and strategy for it, right? So I need to know why that didn't work. You got it?
He has poor imitation skills. Major reason is that.
No, we can't say because of poor imitation, he can't speak. We can't say it. Yeah.
Because he's been
You
doing
tell
all
me,
other things.
when you say him, you put your hand and you just show your hand and put the hand on your mouth or put the hand on your nose. Can he copy it?
No, he cannot.
He can't copy it. Okay. If you say him, I'm going to kiss you, show me how you will kiss me. Can you do it? Like you are showing something, can you do it?
Just by showing he won't, but since he knows that I have asked him to kiss me, he will kiss me. But by
No.
showing or
If you show like, okay, copy me, like something like copy me. When you say
that is the
something, copy
problem.
me.
That is the problem.
So he can't copy anything.
Mostly. Yes.
Okay.
Yes, he can copy like we've been going to a speech therapist for past 1.5 years now, but he can like verbally he can copy. Like if I say ah, he will say ah, e, he will say e. Not very clear, but he can copy that verbal commands. Vocal imitation is there.
Yeah. So it means he has the imitation. It's not like he doesn't. He has minimum, maybe it is like some deficit is there. So why I'm saying it, why you need to know it, the moment we have a conclusion already, he can't do imitations, it means we are blocking the abilities.
Yeah.
You got it? Because only the thing, we only can work on the abilities. He will still do speed, but I need to get what abilities he is. From there, I have to, empower that skill. So what you will do, like, start with the very basic things again, because this is something related to the mouth skill, what you want to develop. So so far you are saying kiss me, right? Okay, now you say, like, you can start with first the gross movement imitation, like really like both your hand just up, very simple. Okay, from there make it towards mouth, like, okay, how mama kiss this way. Can you show the same thing? Just showing, do not need to kiss me. You have to say, just show me.
Right.
Just show me. Okay, now the second thing, toothpaste, this thing will come very late. Okay, what you will start first, you just take a spoon, plastic spoon or something, and ask him, you can put some water on the spoon and you perform that activity. What you need to do, the spoon, he will up the tongue outside. You need to do it actually. He is going to imitate this whole thing. And you don't try all the steps in one day. You will start with the kiss. First 10 session will be only kissing until he really know like this. The second will be the spoon I'm talking about. Now you do not need to like do the kiss in the sky. You just need to kiss that spoon. Bring this like spoon, bring near to you. You will kiss it. Say him to kiss it also.
And the spoon has water in it, right?
It can, you in the beginning, maybe you can give without water, but slowly you need to put some water. This is one. Second, from the kissing, ask him to just the water you are putting now, ask him to lick the water. Just lick the water, licking. Okay, so what happened? First, the tongue movement will start. And I need it. So the speeding, the problem is what? Problem is because he is not doing the proper tongue movement and using your dentist, not using really the proprioceptive input from the inside, right, of the mouth. Like how much pressure need to give. He's not doing it. So what I need to do, I need to train him first. These all, I mean the sense of proprioception, and also how different way we can do the tongue movement, but functional way, not really brush or other thing. It will not work. I believe you did this all. it will not work. Like brushing, all other things, it will not work. Okay, so what you need to do, if you like if you like honey or something, that also you can add. I need this, like tongue should be up, like, but do it because as you said, there is a limitation in the movement imitation. So do it through the movement imitation. It means you will do modeling with him. So this, and once he do this, like, the second thing will be the spoon. Now trained him licking down. The third will be spoon will put on the tongue, hair,
Center of the tongue.
on the tongue. And you have to start a training, like, okay, hold there 1 to 10 count. So obviously you have to do the gradation, okay, just first definitely he will not even do 1 second maybe.
Okay.
But it will be happy. Okay, mama is doing only 1 count. Can you do 1 count? Okay, that's all you need to do, that much. Like the spoon will put on the tongue and the tongue totally out.
Right.
Okay, and once he does this one, the next level will be you will teach him press the spoon on the tongue little bit. Press, but you need to do it, he will follow it. Press. So he will learn the proprioception, the pressure, because right now you are not giving anything where his tongue is getting it's like education, getting the education how to receive the pressure.
Okay. Right.
You got it. So we need to develop that parts. Once we do it, okay, once we do it, you start the training spitting with actually water first, not the other things.
Okay.
Because once he'll develop this skill of proprioception and the sensation, what right now happening, because when you giving something like, the toothpaste or whatever you are giving, he's not getting the the sensation, what he must get it, like, through the tongue, you need to get a sensation. When you put the water or anything, you get a compression throughout your mouth, right? He's not getting the compression.
Okay.
So we need to develop the comprehension. In the same time, the imitation skill he has, it's not like he doesn't. So here also maybe you need to work on how you are communicating with him. How is his communication? His receptive?
Yeah, he is like, can you be more specific? As in,
So when you give an instruction to him,
yeah, he
so
follows
how
the.
he can follow your verbal instruction, how many steps he can follow. It's like only one, or
One
he needs.
one step at a time. One step at a time.
So verbal instruction 1. So he really need modeling for it, or he just a verbal instruction he can follow directly?
Verbal instruction is enough. He doesn't need more.
No, now here also, is it for the when something sophisticated occupation like spitting, he really understand what is spitting?
I don't think he understands what
Okay,
is.
so that's the reason I'm asking. Why? Because here this thing also limited with his cognitive abilities. It's a concept. Spitting is not only your motor function will do. It's a concept. So your concept and the motor function should be integrated together. So you are helping with the motor function, with the spoon activity, all those. In the same time, what you need to do, you really need to do spit a lot in front of him, modeling.
Okay.
He will not do, you have to do. 1 second, use lot of videos like in YouTube, kids are spitting, all those videos. Show him every day before you start all those activity for his mouth. You show him actually what you are trying to do end of the day. You do the spitting not only one time, do in different way, make it like more fun way.
Right.
Make it like fun way, singing song or fun way. So he will get the concept what is really spitting. Because right now you're saying do spitting, you need to take it out, this one from mouth, it's not actually going in his brain. Okay, so one aspect is the cognitive aspect, where you are really developing the concept, what is really spitting. And another aspect is the physical aspect. You are developing how the pressure actually going inside and what, because when you slowly, develop the pressure and compression through the spoon towards his mouth. Oh, so I need to tell one more thing also, because this is very important. So once you start with the tongue, then actually you have to play with the spoon to the side also, both side.
Yes.
Okay. Okay.
Yeah, so he will, it's the ability of the compression feeling, we call it the discrimination abilities, discrimination of pressure. So it's a proprioception, but it's also a part of interoception. Okay, and this skill only will develop when you will do it more and more and more. Okay, and in the same time the concept you will develop, then definitely you will say you will develop the skill. It will not help, and if you go with like all the things like the vibration, all the things, it will not help. You need to do it through functional way. Okay,
In fact,
so here another functional way we'll do. That's okay, this is little weird, but you have to do it. So how he is eating food, when he is eating food, how he is.
He's able to like eat it with the help of a spoon, but he's not able to take a bigger bite.
No, can he swallow it, or can he like really chew it nicely?
I think he doesn't choose very nicely. He majorly follows.
Okay, so what you will do here, it's okay, that is really big things we need to, that is a lot of things we can do, but right now I'm going to like give you some strategy. Like carrot, give the carrot, ask him to just, he can chew it or he can just bite it. After that, tell him, can you take it out from mouth? Don't say spit, say take it out from the mouth.
Yeah, he does that. If he doesn't likes anything, he will definitely
Okay.
take out of the mouth. If he
Now,
doesn't like anything.
did you really get it? What does it mean?
Like he is able to follow my instruction.
This is one. Second thing, spitting is what, end of the day?
taking thing out of the mouth.
Right.
You got it?
Yes, yes.
So you need to change the word. Don't say spit, say take it from mouth. What you are saying with the food.
Okay.
So it's very confusing for him. What is spitting and what is actually taking
Exactly,
from the mouth.
Amit, this is what I was trying to tell in the social stories. Most of the time we are expecting or instructing the child. Actually, it is very abstract. Like spitting, what it is spitting.
He's
But
confused.
yeah, the child is confused. What is spitting?
Yeah, that's what I'm
Sometimes
saying.
another thing I find is blow. What is blowing? If the action you are asking your child to show, they cannot visualize, they are confused.
Exactly.
That's what Amit meant. I am right, Amit?
Yeah, exactly, you are right. So we need to see this cognitive role, it's very important here. So am
Absolutely.
I really making the kids confused?
Absolutely. The
So that we
instruction
need
should
to
be
say.
so
So
clear.
and he has the skill. He has the skill actually. He can take out food from the mouth. So what do you need to do? So here you need to play a clever role. So like a carrot, it's like more hard. So you have to give something what is like more to the liquid, like mashed potato.
Okay.
Or something like towards more to the texture of the things what toothpaste. Okay, some food you need to give that type. Maybe it is like something he really doesn't like, the
The
taste he
word is
doesn't
he
like.
doesn't like. Okay, if he likes, he'll chew and gulp.
He
I
will
know.
chew, but what he doesn't like, he will take it out from the mouth. And that moment you will only say, the way you need to develop this concept, in the way you are taking this food out, do the same thing when you do the toothpaste.
Absolutely.
His brain just need to be aware about it. Yes.
Yeah.
Hello.
Okay, I think her video has stuck. Okay,
Hello.
Amit, are you there? Yeah, you are.
Yes.
Okay,
Yeah.
I think Meghna's video stuck. Okay, both are mobile now.
Yeah.
Okay, let's move on to next question.
Okay, Meghna
That's
was saying
Malavika.
last. Yeah, we can follow up. It's a
Yes,
lot
of
of
course.
discussion.
Thank you so much. Thank you.
Yeah,
Thank you.
sure.
Thanks a lot.
Let's move on
Yeah.
because नहीं तो
Yeah.
सब बाद में मेरे को पीटेंगे. Okay, Malavika, she has joined from Bangladesh. Malavika, you can ask your question, please.
ম্যাম আমি বাংলায় বলছি হ্যাঁ
হ্যাঁ বাংলায় বলো তাহলে অমিত খুব খুশি হবে.
আমার কোয়েশ্চেনটা যেটা এটাও বোধহয় আপনি বলবেন যে হয়তো আপনার জন্য অ্যাপ্রোপ্রিয়েট না আমার ছেলে খাবার মুখে স্টোর করে এবং অনেকটা সময় 2-2.5 ঘন্টা এরকম সব খাবারই স্টোর করে বিশেষ করে লাঞ্চ বা ডিনার যেগুলো আমরা খাই ডাল ভাত মাছ মাংস এগুলো বিশেষ তবে রুটি দিয়েও দেখা গেছে কিন্তু মুখে স্টোর করে অনেক সময় স্টোর করে রাখে আর এটা কিছুতেই ঠিক হচ্ছে না এটা অনেক দিন হয়ে গেল অ্যারাউন্ড 1 বছর এরকম তো তার ওজনও অনেকটা কমে গেছে কারণ এত সময় ধরে রাখে আসলে সবারই খাওয়ানোর আগ্রহটাও আসলে কমে গেছে আমাদের ও আর চুইং এর ব্যাপারে বলবো সবই চিউ করে খায় কিন্তু এই যে মুখে খাবার রেখে দেয় এই আর কি এটা কি করতে পারি আমরা
ঠিক আছে এই ব্যাপারে আপনাকে
Amit, just hold on. Amit, এক minute, এক second now. Everybody who wants to ask a question, just put your name in the chat box and in a role wise, I will call. First come first. Like everybody is putting their name, put it in the chat box so that I know you are in line. Okay, you cannot in between raise your hand. Just নিজের নামটা chat box এ লেখো আমি one by one will call. Okay, thank you Amit, sorry to interrupt.
উনি এখন অবধি কি স্ট্র্যাটেজি বা ইন্টারভেনশন এর জন্য করেছেন
এর জন্য যেটা ইন্টারভেনশন আমরা ওই প্রবলেমটা শুরুতে ছিল না কিন্তু আমরা অনেকদিন ইন্টারভেনশনের পর জানতে পারি যে ওর টাংটাই আছে টাংটাই অপারেশন করার পর যে
ভয়েস ব্রেক করছে
হ্যাঁ ভয়েস ব্রেক করছে
ম্যাম এখন কি শোনা যাচ্ছে
হ্যাঁ শোনা যাচ্ছে কিন্তু খুব ডিস্টার্ব আসছে তুমি একটা কাজ করো মালবিকা তুমি একটুখানি টাইপ করে দিয়ে দাও উইল রিড ইট ওকে কেন ভীষণ ডিস্টার্ব আছে শোনা যাচ্ছে না তুমি টাইপ করে দাও ততক্ষণ পুষ্পা নিজেরটা জিজ্ঞেস করুক আমি তারপরে তোমারটা নিচ্ছি কোয়েশ্চেন ঠিক আছে পুষ্পা ইউ ক্যান আস্ক
আমি ওনার যতটা বুঝতে পেরেছি আমি অ্যানসার করে দিচ্ছি বাকিটা নীলাঞ্জনা তুমি ওনাকে হেল্প করো সেটা হচ্ছে আমি কেন জিজ্ঞেস করলাম কোন স্ট্র্যাটেজি ইউজ করেছি কিনা কারণ এই যেটা মনে হলো এই বাচ্চাটির কোনো টাইম ওর ভেতরে কোনো টাইম কনসেপ্ট ডেভেলপ করা হয়নি ঠিক আছে ডিউরেশন কনসেপ্ট যেটা হয় দেখো আমি যদি না বুঝি ডিউরেশন কনসেপ্ট কি আমার নিডস কি ঠিক আছে যে এই উইদিন টাইমস আমাকে ফিনিশ করতে হবে আমি জানি না ওর সেই অ্যাবিলিটিসও আছে কিনা যদি থেকে থাকে প্রথমত সবার আগে হচ্ছে তোমাকে টাইমার ইউজ করতেই হবে এখানে ঠিক আছে এন্ড ইউ হ্যাভ টু লাইক সেটা শুধু খাবারের জন্য টাইমার নয় সবকিছু ওভারঅল সবকিছুর জন্য টাইমার করতে হবে যদি টাইম না বোঝে জাস্ট যে যখন রিং বাজবে তার মানে ফার্স্ট রিং বেজেছে সেকেন্ড রিং এর ভিতর তোমার খাবার কিন্তু কমপ্লিট করতে হবে ফার্স্ট রিং বাজলো সেকেন্ড রিং এর ভিতর খাবার কমপ্লিট করতে হবে বিকজ বাচ্চারা যদি এগুলো না বোঝে কারণ অনেক সময় আমরা যে বলছি তোমায় তাড়াতাড়ি খেতে হবে তোমাকে শেষ করতে হবে বাচ্চা বুঝতেই পারছে না তাড়াতাড়ি শিক্ষাতে কেন খেতে হবে আমাকে তাড়াতাড়ি আর কেন শেষ করতে হবে এটা হচ্ছে একটা সেকেন্ড হচ্ছে আরেকটা যেটা আমরা করি সেটা হচ্ছে যে প্রাথমিকভাবে ওকে মোটিভেট করার জন্য So, and what we do actually to motivate the kids, obviously we are giving a timer, like you need to finish it. The second thing what you do for, motivate the kids, we actually give something like what is really interesting, like a reward system. So what happened, if you can finish, your this task, just take as a task, don't take as like feeding or something. So if you finish this task within this time, you are going to get it. So obviously they will do it. They will repeat it more and more. Their time will be changes. But it is really difficult, like again, without proper assessment. Like what I really need to know, the cognitive abilities of the child, I need to know. I need to know really there is some like muscles issues or not. I need to know. So, fourth thing is very important. Even the food, we are talking about the child, but the way we are presenting the food, what about it? What type of food presentation we are doing? It's very important things. Your food presentation, you can't say what we will have, the child will have the same thing and same texture. So what is your food presentation? That's very important. Third things, it's so important what is the environment there. The TV is on, the people are just going and coming and here there. Is there anyone really with him for a while? Only the feeding time? Is the person really talking or nothing doing with him? And the other thing is the feeding is only the recreation he has. Okay, like a lot of things, you know, we feel sometimes, oh, kids, they, you know, we can just do. No, we can't. If this kid find out, you know, if he can be like a 2 years, 3 years, anything. If a kid find out the whole day, the most pleasurable activity for him is actually only the feeding time, he will definitely take time. Because it is only the thing he feel more pleasure. So we are not giving the kids the other pleasure thing what actually he can get. So you have to find out some alternative, because he may have a limitation of exposure what really his pleasure, but he have always food, he know this is something he get the pleasure, so he will take more time for it. And
I want
another
to
thing,
add something,
yeah,
Amit, here
yeah,
something else I want to say. Most of the parents I have seen, they have to understand this, that there are some children who really cannot have rice or the roti.
exactly.
Don't force feed. Don't force feed. There are certain textured food, they really find it difficult. Just see that they have healthy food.
Your child can die, I'm telling you. If you really force, he can die. You know, I'm actually doing a research now. We call it the problem feeder group. And we found out there is a lot of child, they have like, you know, life-threatening issues with this. Yeah, you can't. The sensory problems of feeding, it's very real. It's really real. You know,
That
so this
parents
was,
need to understand.
yeah.
The force feeding, I had a child in Siliguri from North Bengal, they had contacted me. GFCF diet, they did not understand, okay. And the child was having only leafy things, and that too he had stopped. He was given
Is it for the
intravenous.
autism? Is it for the autism?
He is from autism.
Okay,
He got so severe.
let me tell you this thing. This is bullshit. Okay.
Yeah, thank you.
This is bullshit.
That's
There
why
is
I
no
love
evidence.
you.
There is no evidence for it. This is bullshit. If the child give the food, whatever the child can eat, there is no restriction. There is no link in between your child disabilities or autism and in between the food. Give the food whatever the child can have. Second thing, if the child cannot have the food what he really needs, you know, for the nutrition purpose, so there is a way, there is a technique how you can develop the texture.
Absolutely.
But it is not really forcefully. There is a technique, we call it like, you know, there
and
is
it can traumatize.
lot of approaches.
It
Yeah,
can traumatize a child.
yeah, don't do it. If you do it, it will actually affect the child brain. Yeah, what you said, whatever you say, the traumatization, it's
Yeah.
can, yeah. Yeah.
See, you deal with the whole disability sector. I deal with neurodiversity. So I know.
Yeah. No, because I need to see, because we don't see only the autism, we see
Yeah.
all
That's why you
category,
have the
all
horizon
diagnosis.
more than I have. Mine is stuck only with neurodiversity. Okay, Maluvika, you got your answer? So next, let's go to Pushpa. Pushpa.
Yes. Good evening, first of all. I have a son and 10.5 years. His diagnosis is autism, and his functional limitations is he's banging every time. Some object he wanted to bang. Sometimes he bang his hand on floor, on wall. I know that he's seeking for the pressure, but sometimes I understand it will be hurt, because when he forced to wall for a bang, I know that something is there, but he need that type of pressure. So I wanted to know that what should I provide that which help him to seeking his needs, and also it will be somehow it will not hurting him.
Yeah, it's really a very common issues, but I want to know what you did so far.
Sir, I just wanted that, but because when he hit the wall or he banged on walls, that was very much high pressure. I understand, and he
I'm
need that
saying like
sense.
what strategy or intervention you did so far.
No, I don't understand. What should I do? That's why I want
Oh,
help.
but he's 10 years old. You never did anything so far.
No, and this issue I had seen from last 2-3 months, not very old.
Oh, okay. Yeah, that's very important information. You need to give proper information. So it means, okay, first thing, this is not a sensory issues. Okay, everything is not sensory, but this one definitely not sensory, I can tell you. Okay, find out what happened in this the episode of this time, like when it started. Find out his lifestyle there, what happened, what changes happened. And he's 10 years old. What about his, like he's growing, he puberty. You also need to understand now what he's doing every day when he's alone at like his room. Okay, how much time he is touching his private part, is he touching or not? Okay, what other thing he is doing, everything you observe, you will get the answer why he is doing it. It is not sensory. Don't focus pressure, this thing means sensory. No, there is a reason, there is definitely a reason. Okay, but the reason, don't limit your vision only through the sensory, then you will not get it, you will not get the answer. So you try to go back, find out the changes when happen, what happened. In the same time, because he's 10 years old, see his biological needs, is it starting, is there some changes is happening? See his body structure, the body structure is changing, is there the things is growing, this thing, even the other private part is growing, how the hormonal changes is happening and how he's coping up with it. Okay, see this all aspect, you will get answer and support there. This behavior what he is showing, it will reduce.
Absolutely. That's
Okay.
why I keep telling parents functional assessment karna seekho, because
Yeah.
you just can't assume the problem. You cannot assume, Pushpa. It has to be definite. So functional assessment, I keep telling you people. So I'm getting a lot of support from Amit.
Thank you, Amit sir.
Okay.
I do agree with Niludi, and I'll be in touch with you, Di.
Yeah, please, you just go with it. You just try to analyze his current situation.
Yeah, absolutely.
And there is a lot of strategy actually coming down his
Absolutely.
all the things and balance his hormonal changes.
Absolutely. Okay, next we have Shayoni and then we have Raksha. Shayoni? Shayoni, are you there? Okay, she's not there. Raksha, please.
Hello, ma'am. Hello, sir. My son is going to be 5 in another 10 days. And his functional is, it's pretty much ASD. And the diagnosis is autism. So my question is, he has a lot of visual seeking need. From your previous answer, I'm thinking it might not be a sensory thing also, but let me ask the question what was in my mind. So he arranges things in a particular order, in a pattern. Okay, and it's okay. We don't. He does not want us to touch it, and it's okay. We allow him to do what he wants to do because he enjoys it. But what has happened is when we work with him tabletop, or if you go to a restaurant or we are at somebody's place, he wants to do the same arrangement with new things which he sees there. So it's not socially acceptable in many other places. So I don't know if it's a sensory issue, and what I have to do so that I can give that kind of activities which will keep him, fulfilled, sort of a thing, or if it is some other issue not related to sensory, and
I got, because this is very common. This is very common case. Like I have deal like this type of like thousands of clients actually, so I know what's your question already. Okay, the thing is, Yeah, this is also a part of the sensory. So when you say sensory, it's not only the modulation. There is something called, and the sensory related motor dysfunction, and that's related to the motor planning issues. So maybe he has a little bit dyspraxia. Dyspraxia means the ability to plan the things. So what happened? It's limit his ability of ideation. So what happening, because it's very easy to maintain a pattern. He see the things is like, he noticed the thing, how everything organized, and he just maintain the easiest pattern. So everything is put in the lines. So this is a common issues those have, we call motor planning. I mean, Nilanjana, I think you also know about it. So the kids, those have motor planning issues, they will definitely do it. This is one. But in the same time, the thing is, when you find out the why kids have the issues of motor planning, obviously it can be, as I said, the processing issues, sensory processing issues. But in the same time, it is a lack of exposure to the movement activities. So you think about it, how much time, because he's a 5 years old, do you know how much time a 5 years old child should play physical play? Do you know it? A day in 24 hours?
He has about 2 hours of park time where he keeps moving around, and in at home I do like spread out throughout the day 10 minutes of OT activities which I've been taught by his therapist. As such, he
So
might probably
average,
get about
he's
2 to
doing average 2 hours per day, like physical
yeah.
activities.
But park, yeah, we take him to park every day.
No, what he does in park?
He
Taking
plays
in
the
park
swing,
is
slide, including
okay.
he does lot of pretend play with his toys. Very less social interaction with the other kids. I mean, we don't force him because it's hard for them.
Play
No,
I
concept,
understand.
it's okay.
play
You
concept
see,
is not clear in Indian context when it comes to spectrum children.
okay, the thing is, actually you are answering by yourself, you are doing already awesome job, but the thing is, force is something and facilitation is something. You got it? You really do not need to force, but you have to facilitate. Like my child doesn't like to play with others. Absolutely, it's his rights, or because of his problem, whatever. But it doesn't mean I will not encourage my child to play with others. I will do, but yes, not forcefully, but which way? I need to do it with facilitation. So there is a lot of facilitation techniques, how we'll do based on the child interest. Like I give an example. Tell me, what is the most favorite activity your child love to do when he's in swing, like when he's in park?
He likes the movement. He keeps looking. I mean, he likes the visual movement, I think. So
No, that's
I
okay,
add
absolutely okay. So what activity he like swing? He likes swing,
yeah.
sliding,
He likes
anything?
the
He
swing,
likes swing.
sliding,
Okay, what
climbing.
about it? What about how the facilitation happen? I tell you, just give example. So when he's doing the swing, if there is some other kids, if you can, it's not his job. You can just encourage other kids to come and help him to just push from the behind. You got it? You need to make the connection first.
Yes.
Okay, once he will make the connection with the new kid, and it will happen, your kid will feel secure, and slowly he will start to play with that other kid. So this is called facilitation, how you do. I'm just giving one example. You can't say your kid, okay, you go and play. No, he will not do, because this is his problem. So our responsibility, we will not bring him to our world. We will go to his world. Okay? And from his world, we will slowly bring him to our world. That is the strategy. So we call it back and forth strategy. So I'm just giving you an example. Like if you say me something other thing, like, okay, now here another thing, how you can develop even the motor planning. Okay. So that's the reason I'm saying it's not only you are just playing physical activity you are doing, that is not therapy. Therapy is something when he is doing swinging, because he likes swinging. So in the swinging, how continuously you're providing something we call just right challenge. Just right challenge means a challenge. What if your child he can actually overcome it. So how he will overcome? Obviously, when you give some challenge, he may feel like I don't want to do, he will not do, he will not feel interested. So again, this is our responsibility, how we facilitate to do it. So as example, he is doing the swinging, when he is doing the swinging, you just ask him, okay, you can doing the swinging, can you just just give him a ball, just hold his one hand, ask him to hold his one hand and do still the swinging he is doing. So when he's holding a ball with his one hand and is still doing the swinging, it's actually giving him a challenge, right? Some changes is happening, right? So this is the way the motor functions develop, the planning develop. He will know we can do the same thing in different way. So far, he only know I need to sit and hold the swing and I will go forward and backward. He doesn't know anything apart from that. But when the moment you will say you hold this ball, still you can do the swinging. It means the same thing he is doing in just a little bit different way. So think about it every time, whatever he is doing, how you can facilitate him to do it little bit different way. Every time. Little bit different way. Then what happened? He will break his rigidity. Okay? Because rigidity is something what stuck you always, but how you will break it? With the practice. So you need to do more and more the practice. Any skill in this world only develop with the practice.
Absolutely.
Okay. So other than you can't do anything. So you just need to know how much I can give today to my child plate.
Sure.
You got it? So
Sure.
very small changes do what he is doing from there. It's not totally something new you are giving. No, he's doing something. There you are adding something new, very small changes. And when these small changes every day will happen, you will see a big changes is going to be happening.
Sure.
And he will learn to accept the differences also.
But there is one thing, Amit, I want to add a question here. What's wrong in lining up? Why it's not considered a socially appropriate thing? Lining up.
Oh, this is you can answer better than me, because this is really the social rigidity. Okay, but okay, here also one thing, it's a very important thing. If I see the child is actually doing everything, okay, there is no problem in his function, is his daily life, but he just love to put the things in the same line. That's can be something really he feel good, some soothing thing for him, we never know. And if he is like to do it, what I always suggest, so I'll suggest okay, see, this is a problem with the social context. We can say, okay, whatever your son name, you can train him. I know you really like it, and we can actually do it. Maybe not the right time now. Once we go home, we will do it the same, because this is something maybe what he does, and he feel good.
Absolutely.
And you want to take it out, all those pleasure thing, what he really love to do. Absolutely. You think about yourself. Even we are all neurotypical. You think there is a lot of things, we call it privacy. In our private life, we do a lot of things that is really not socially appropriate.
Rather,
right?
Amit,
I'm not breaking the things, but just saying lot of things we do in our life, but that is not socially appropriate, but still we do, because we know how to maintain the privacy. Rather what I will say is, rather what we therapists will say, that convert it into a strength. If a child is lining up, take it as a relaxation activity. Yeah, and not only that, you can do structuring with him, and the beautifully he'll respond. Don't take it as a social blockage. Make it a strength, and you'll be amazed at how much they can learn through this one skill.
Okay.
Yes.
So
So you
make it
can
a
use it as
strength.
reinforcement.
Of course, you can reinforce, sequencing, serrations, mathematics will be so clear if you encourage that. Don't block, redirect, or make it a skill strengthening. Don't try to block things. They cannot take it. They do it because it's a soothing for them. Okay, Raksha. Now, the problem is time constraint. So I will only request Malavika question type to chat box se poro because it was pending. So that's the last question we are taking. Don't worry, I will not let Amit go. Those who couldn't ask question will again arrange this. So please.
Question ta bolo to.
My son is 4.5 years old. After tongue tie operation, our speech pathologist did opt. He used to talk tools. My child didn't like that and didn't want to do that, crying, running, etc. We did 1 year this talk tools things. After 3 months of doing talk tools, he developed this, storing food in the mouth for this long time. She's saying that after the operation, this problem started.
So, the problem to give, what right now? Why I can't see the comment?
She's keeping food in her. Actually, she has directly given, not to everyone. That's why the message is given directly to me by default. So what OJ tongue tie operation ta hoyechilo, after that he has developed, and it seems the speech pathologist was deliberately forcing him to use talk tools and all, and then he started, I think it's kind of, he took it in a very negative way. That's the problem triggered from there. It's kind of
টিউব যেগুলো থাকে লাল রঙের সেগুলো হচ্ছে ওই যে টান দেয় তারা। তো আসলে ও তো অনেক ছোট ছিল তখন, 3 বছর বয়স মতো ছিল, মানে মাত্র হয়েছে এরকম। তো এইগুলো আসলে একদমই করতে চাইতো না, কিন্তু টাং টাই অপারেশনের পরে ও যেহেতু টাং মুভমেন্টটা প্রপার না, তো এগুলো নাকি করতেই হবে। এই কারণে আমরা প্রায় 1 বছর মানে ওইটা করি। কিন্তু
আমি বুঝতে পেরেছি, আমি অ্যানসারটা দিচ্ছি, and I want to give it like in English because this is a very important thing. See, the toolkits is not bad thing, it's really good, okay, but the thing is again how you facilitating it. I want to really use this approach. It doesn't mean I will force you to take it and do all this. No, the main therapy is not that. Anybody can buy the toolkits and force, and you need to chew it, you need to do it. No, that is not therapy. That is absolutely not therapy. Therapy is how you facilitate that toolkit to use actually. So that is the big mistake happened. I really feel sorry for you, they didn't facilitate it. They did forcefully something that is not appropriate. Now the second thing I come, so whatever problem right now he has, okay, second thing, if something he really developed the trauma, don't introduce it again. Like if he has a trauma with the toolkits or something, don't give it again. But in the same time, if you really want to develop the oromotor function, okay, because as a OT I can talk about oromotor and orosensory more. So what you will do, you'll always prefer, like he's, how old is he? 12 years.
4.5 years.
Oh, he's only 4.5 years. Okay, that's really nice age. So what you'll do, you try with the food. Like what you need to do, you try the food, those like carrot, you can actually make a slice, a strong slice like a toolkit. How his toolkit looks like, do the same thing with the carrot. Now you can actually change the resistance of carrot also. How you can change? You can boil it. It will be more softer. So you can choose different type of food, like can be a cucumber, can be the carrot. You can choose different type of, and you make it like a stick, make it like different, and use it. Sometimes you can give it boiled, sometimes you can give it raw. It's depend on the, I don't know the abilities right now what he has, and based on it you can actually introduce it and use it. Like what do you need to do? Again, what I told before with the Meghna, it's about how you're introducing the the concept through your imitation. So when you say imitation, It's actually all modeling. Kids, they don't like to do something alone. They prefer, okay, adult will do, then we will do.
Yes.
So you have to do the same thing, what you are, what you want from him, you have to demonstrate it. You have to do the modeling, constant modeling. And when you do the modeling, don't assume they will learn all the whole steps in one day. No, they will not learn. You just need to teach step by step. What I earlier told to Meghna, you just only, bring the spoon towards the mouth. That's all. It's like same thing. If he doesn't like carrot, just train him fast, kiss the carrot 5 times or maybe 1 times, then bring it, okay, just hold, put it in the mouth and hold inside your mouth for 5 counts.
I have a question here.
Hello.
হচ্ছে স্যার এই যে আপেল গাজর এরকম যে খাবারগুলো আছে এগুলো তো একদম চটপট মানে চিউ করে ফেলে, মানে খেয়ে ফেলে। প্রবলেম হচ্ছে লাঞ্চ ডিনার যেগুলো আমরা মানে বাঙালিরা আমরা যেগুলো খাই, ডাল ভাত এগুলো যেগুলো কিনা প্রবলেম ছিল না এখন হচ্ছে, ওগুলো খায় না, মানে খাই না, মানে ধরে রাখে, মুখে ধরে রাখে 2-2.5 ঘন্টা। মানে দেখা গেল যে আমি ওকে মুখে এক গ্লাস দিয়ে আমি থেরাপি সেন্টারে গেলাম রিক্সা করে।
তাহলে আপনাকে একটু, তাহলে এটা ওরমোটার ইস্যু নয়, ঠিক আছে? তাহলে আপনাকে একটু ওর ফিডিং অ্যাসেসমেন্ট করাতে হবে, ঠিক আছে?
ইয়েস,
ঠিক আছে। আপনি কি হচ্ছে, যখন আপনি ভাত ডাল মিক্সার করছেন, ঠিক আছে, যখন মিক্স করছেন 2-3টে ফুড একসাথে, তখন সেখানে মাল্টিপল টেস্ট আর মাল্টিপল টেক্সচার একসাথে ঢুকছে,
5 minutes,
ঠিক আছে? তো মাল্টিপল টেক্সচার আর মাল্টিপল যখন ফুড একসাথে ঢুকছে, হাউ হি ইজ রিঅ্যাক্টিং ইজ ভেরি ইম্পর্টেন্ট। সো আপনার যদি ওখানে কেউ থাকে, দোজ আর ট্রেন্ড ইন SOS অ্যাপ্রোচ, ঠিক আছে? একটা অ্যাসেসমেন্ট করিয়ে নিন তার থেকে।
ওকে,
SOS অ্যাপ্রোচে তাহলে এক্স্যাক্টলি বোঝা যাবে যে ওর সমস্যাটা অ্যাকচুয়ালি কোথায়, এটা কি টেক্সচার ওয়াইজ হচ্ছে না টেস্ট। আর আপনি যে খাবারগুলো খেতে অসুবিধা হচ্ছে, জাস্ট একটা এক্সাম্পল আপনাকে দিচ্ছি। আপনি ধরুন ওকে ভাতটা খেতে দিচ্ছেন না, একটু কোয়ান্টিটিটা কম 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 দিয়ে শুরু করুন, কোনো কিছু না মাখিয়ে শুধু ভাতই দিন, ঠিক আছে? অথবা আপনি টেক্সচারটা চেঞ্জ করে দেখুন ভাতের,
ফ্রাইড রাইস দিয়ে দেখো,
একটু ফ্রাইড রাইস দিয়ে দেখতে পারেন, আপনাকে একটু আলাদা আলাদা করে দিয়ে দেখতে হবে, দেখুন কি হয়।
So Amit, yeah, sorry, I interrupted. We have already taken a lot of time off, Amit. Thank you so much, Amit. What I want to say, we will continue this class, so don't worry. Again, we shouldn't be, stopping him. Is already nearing quite a night there.
Here so it is actually 9:30 already.
Yeah. So please do give us another time, and this time we'll make sure those who couldn't ask the question can ask you beforehand. So we'll do that.
Sure.
Okay. Thank you all of you being there. We are leaving him.
Yeah, I tried my best. I don't know how much I really actually supported you.
If somebody wants consultation, he's there in the parent empowerment group. You can take his time. You can understand with him directly. But if you have some questions, you put up in the group.
Again, I want to tell here, it's maybe sound bad, but there's something I want to say. This is my profession, okay?
Of course.
As it is my profession, so I really love to do profession like to do profession as profession. I don't like, okay, just randomly do this and this. It doesn't work in the day.
Of course.
It doesn't work. I did a lot this thing, I found it doesn't work. So I prefer it's a group, something charitable. You can invite me. I can join it. I can do more actually group if you want. I would love to
interactive sessions he can always do, but if it's child specific problem, you need help, you have to do it in a very professional way.
Exactly. If you really want something to deal with me privately, you have to really come through the proper channel. Otherwise I can't help.
Of course.
Because I'm telling you, I'm in this field now 12 years. So like first 2 to 3 years, I did a lot of things, and I found until you are really, follow some structure, it doesn't work.
Absolutely.
That's the reason.
And the structure relates to everything. Even if you want to teach your child, structure is everything. That's so redeeming. Yeah, it's true. It's true. So let's leave him. It's a good night time for him. Thank you, Amit. And I will
Bye-bye.
definitely take
See you soon. Yeah, you can, Nilanjana, you can actually, I
I'll
can
take
join
your
your
time.
group session.
Okay,
You
sure.
can arrange it often. I'm okay.
Sure.
Yeah.
Chalo, take
Okay.
care.
Thank you, everyone.
And advance
Bye-bye.
happy Holi.
Yeah. Thank you.